Hello, my name is Barb Farrell, and I'm a pharmacist at the Geriatric Day Hospital at the Bruyère Hospital in Ottawa, Ontario, Canada, and one of the lead researchers of the Deprescribing in Ontario Long-Term Care Initiative. It can be hard to know how to have meaningful conversations with your healthcare provider about medications. Shared decision-making is a way for people to share their medication goals and experience with healthcare providers, who in turn share their knowledge of medication effectiveness and side effects, so that together you can determine the best approach for you. This video was created to help you to have these conversations with your healthcare provider by showing you an example. Let's introduce you to who you'll see in the video. Ranbi is the husband and substitute decision maker for his wife, Prada. Prada is an 84-year-old woman who's been living in long-term care for the past year. She has moderate to severe Alzheimer's disease dementia. Ranbi, who visits his wife every other day, is meeting with Dr. Dodds, the physician at the long-term care home. Let's watch as Ranbi and Dr. Dodds have a conversation.
Hello, Ranbi. Nice to see you again. How are you?
I'm very good, doctor. How are you?
I am fine. So thank you for meeting today for Prada's annual care conference. We will hear from the whole team in a few minutes, but I thought we might review her medications first, if that's okay with you.
Yes, that sounds great.
Okay, great. What questions do you have about her medications?
I'm not sure, doctor, if it has anything to do with her medications, but I have noticed a change in Prada over the last few months, and I think her dementia has gotten worse. We are not able to have the same conversations we had before. It looks like she needs help for almost everything from the staff.
Yes, you are right. Prada's dementia has unfortunately been getting worse. And that's something that I wanted to talk to you about. So I am glad you brought that up. I have reviewed Prada's medications with the pharmacist and wanted to speak with you about the donepezil she is taking.
Is it the dementia pill, doctor?
Yes, that's right. Donepezil is Prada's medication for her Alzheimer's dementia. This medication, like all medications, can come with the potential for benefits and risk. And over time, the risk and benefits can change. That's why it's a good idea to reassess it from time to time to see whether the benefit of continuing the medication outweighs the potential risk, or whether it may make sense to try tapering it. Would it be okay to review that with you now?
Sure.
So Prada has been with us for about a year, and I have on her file that she has been on this medication for at least 3 years. Is that right?
Yes, she was started on that medication at the memory clinic.
Okay. And did you notice any difference after she started taking it?
To be honest, not really. She would have good days and bad days, but she kept getting worse and eventually came here because she needed more care than I could possibly get for her at home. She didn't seem to have any bad reaction to the medication.
Okay. So based on what you were telling me, and taking into account that Prada's dementia has progressed to where she now needs help with all aspects of her care, the risks of continuing, such as stomach upset, slow heart rate, and falls, may outweigh the benefits, and it is also adding to the number of pills she has to take. I would recommend that we consider a trial of stopping her donepezil. What do you think about that?
I'm not too comfortable with that. What if it is providing some benefit which is better than nothing at all? As I said, she hasn't had any bad reactions to it. I guess, what are the risks of stopping it, doctor?
Well, there is a risk of her thinking or behavior getting worse. We would monitor for this regularly over the next few months, and you could also. This would be a trial, and if there is any noticeable change that we think might be because of stopping her donepezil and not the progression of her dementia, we can always consider restarting it. There is also a small risk of a withdrawal reaction. To help avoid this, we could lower her dose in half for 4 weeks before stopping it.
I see. I think I would be more comfortable if we could first ask the doctor at the memory clinic who prescribed it. I want to make sure that they are also okay with this plan. Could you help make that happen?
I understand. I can send the consult to the memory clinic. Then we can revisit this conversation once we hear from them.
Yes, that would be really great. Thank you.
Okay. Hello, Ranbi. How are you doing today?
Very well, doctor. Just keeping very busy.
Excellent. So I wanted to revisit our conversation about Prada and her medication for dementia.
Yes, were you able to reach the doctor at the memory clinic?
I was, and I heard back from them this week. They agreed that it might be worth trying to stop donepezil, especially if the benefit does not seem to outweigh the potential harm.
Okay, if the memory clinic is okay with that, I think it is worth a try. I feel good knowing that it can be restarted if we have to. Also, I think Prada would like to get rid of some pills at least, and it would make her days a lot easier. She never liked taking a lot of pills anyway.
Very well then, we will go ahead and reduce the dose. Right now, she is on 10 milligrams, so we will lower it down to 5 milligrams. How about we plan to speak again in 4 weeks to check in before stopping it? I will let her care team know as well, so everyone is aware and can help monitor and report how it is going.
That sounds good. Would you be able to write down what I should be watching for when I'm visiting?
Absolutely. I will share this handout with you at the end of our meeting. It has a chart that tells you what to look for. You can report any changes that you may notice to her nurse.
Yeah, thank you, doctor. I would really appreciate that.
Did you have any other questions about this?
No, not any at this time.
Okay. If you do have any questions or change your mind, please let us know.
Sure, I will, doctor. Thank you.
This conversation between Ranbi and Dr. Dodds was an example of a meaningful shared decision-making conversation that took place over time. Ranbi considered that a decision about his wife's donepezil needed to be made, asked about the benefits and risks of the different options, and listened to Dr. Dodds as they explained about reasonable expectations. Ranbi expressed his preference for involving relevant members of Prada's care team, specifically the memory clinic that prescribed the medication. Once Ranbi felt informed about each option, he considered and discussed his wife's goals and preferences with Dr. Dodds so that together they were able to reach a decision about the medication that everyone agreed with. If Ranbi were to change his mind, he knows it's important to let Dr. Dodds know. While this video used donepezil as an example, this type of conversation could happen with any medication. If Prada had been capable of making her own decisions, this conversation would have occurred between Prada and the physician. For more information and resources about shared decision-making and medication management in long-term care, please check out our website at www.deprescribing.org or contact us at deprescribing@bruyere.org.